A very good morning, good afternoon, good evening to all. Welcome. Welcome, and we wait as participants are entering this session. This is the a virtual event, the side event to the High-Level Political Forum on Sustainable Development, which is jointly organized by the EU and Germany, BMZ, and DCI partners, GIZ, the Spanish Corporation, FIAP, Expertise France, World Bank, and the ILO. So welcome. The title of this session is Supporting the Digital Transformation and Interoperability of Social Protection Systems Globally towards Achieving the Goal of Universal Social Protection by 2030. It's a privilege for me to moderate this session today. And I will have some preliminary notes to give you. First, this session will last 1 hour approximately. The webinar is recorded and recordings are shared afterwards. There is a Q&A box, but unfortunately there's no time to respond to the questions live. But we hope we can respond during the event to some of the questions. In any case, we will make available a DCI email address, and we will share that address. So if you have, we may address some of the questions, and you may also ask follow-up questions. So without further ado, let me introduce the first speakers today. Shahra Razavi is the director of the Social Protection Department at the International Labour Organization, Universal Social Protection Department. Prior to joining the ILO, she was chief of the research and data section at UN Women. She's also a researcher at the United Nations Research Institute for Social Development. She has published extensively on social policy, social protection, gender, and work. She's a graduate from the London School of Economics and the Oxford University. So over to you, Shahra.
Good morning, good afternoon, and greetings to everyone from HLPF here in New York City. I'm very honored to be joining this launch event today. The Global Partnership for Universal Social Protection, USP2030, aims at accelerating progress towards universal social protection. The USP2030's call to action emphasizes the need to provide, and I'm quoting here, universal access to social protection and to ensure that social protection systems are rights-based, gender-sensitive, and inclusive, leaving no one behind. Now, digital technologies are key enablers of this ambition. They enable inclusive delivery at scale, to close gaps and accelerate progress towards universal coverage. The unprecedented scale and speed at which countries were able to deliver social assistance during the COVID-19 pandemic, I think, is a testament to the potential of digital technologies. Now, despite widespread recognition of the benefits that digital solutions bring, as we know, countries are struggling to fully realize them. In far too many countries, and we know many of them, fragmented social protection information systems are unable to communicate with other systems. This lack of harmonization and also lack of interoperability not only impacts on social protection outcomes, but it also leads to a wastage of precious public expenditure. So the Digital Convergence Initiative provides a unique opportunity to bring together countries from all over the world to share their practices, to learn from each other, and to bring together common standards and be able to build these common standards in a joint up way. Now, the objective of this new project, with the financial support of the European Union and Germany, BMZ, is to support the digital transformation and increased interoperability of social protection systems in 10 countries that are aligned with global standards. This age of profound and accelerated technological change especially with artificial intelligence and digitalization, as we know, brings enormous opportunities for developing countries to be able to leapfrog their social protection systems, to reach new people, to ensure they're effectively enjoying their social protection rights. But as we know too well, it also brings about enormous challenges. Some social protection systems may lack the skills and organizational readiness to adopt digital solutions and therefore may fall even further behind. And those who are quick to adapt the new solutions may lack the solid foundations for really being able to have a human-centric solutions that respect fundamental human rights, to equitable, gender-responsive, climate change and shock responsive and inclusive social protection systems, which is the goal that we all share. For the UN, digital transformation needs always to be aligned with the objectives of social justice and with the fulfillment of human rights. This alignment with human rights standards is absolutely key. It needs to be always guided with a concern to really laying the foundation for a more fair, more inclusive, just, and sustainable futures. So let me end by saying that the ILO is extremely proud to be associated with this unique effort with partners from France, Spain, Germany, and the World Bank to help countries transform digitally and fully reap the benefits of new digital technologies by sharing and learning together and supporting all to be able to navigate digital transitions and automation, to navigate the challenges and opportunities that artificial intelligence provides, and also digital innovation in ways that actually promote social justice and human rights. DCI is important for turning into reality the commitment we have all made to the USP2030 partnership, which is a world where everyone has effective access to social protection when they need it. I thank you very much and wish everyone an excellent panel and a very effective and productive session. Over to you, Luis.
Thank you so much, Shahra, and thank you for joining us from New York. And I know you're going to have a very busy day at the high-level political forum. So thank you for making this opening with us. I now turn to Martin Seychell. Martin Seychell is the Deputy Director General at DG International Partnerships, DG INPA, at the European Commission. Prior to the appointment to his current role in June 2020, he was responsible as the Deputy Director General for directorates dealing with public health, health systems and products, represented the European Commission on the Management Board of the European Centre for Disease Prevention and Control for 9 years. And before joining the EC, Martin Seychell occupied the post of Head of Directorate of Foodstuffs and Chemicals at the Malta Standards Authority between 2001-2006, and served as Director of Environment Protection at the Malta Environment and Planning Authority until 2011. So, and he is a graduate in chemistry and pharmaceutical technology. Very welcome, Martin, and the floor to you. Thank you.
Thank you very much, Luis. Ladies and gentlemen, colleagues, I'm very proud to be here with you today to announce the launch of the EU-funded financed flagship initiative on social protection with a focus on the digital transformation of social protection systems globally towards achieving the goal of universal social protection by 2030. This initiative builds on the existing work of the Digital Convergence Initiative, a global initiative, as you know, of development partners, the private sector, and governments. The DCI was established in 2021 to build a set of consensus-based standards and guidelines for the interoperability of social protection systems. And it has already successfully laid the foundation of this complex technical mission. It has set up processes, standards committees, and already developed standards for interoperability between civil registration and vital statistics and social protection management information systems. GIZ, the ILO, and the World Bank have been successfully driving this initiative for the past few years. The new EU contribution of 18 million euros will help expand and enhance this partnership in three ways. First, in addition to Germany, which has driven the initiative so far and has committed to continue supporting it, our contribution will also bring in France and Spain in a Team Europe approach. Our colleagues from Expertise France and the FIAP will contribute with their technical expertise and unique local experience to reach a wider range of partner countries. Second, the new EU contribution will also directly support openIMIS, an open source software for the management of social protection and health programs. openIMIS is also implementing the standards developed by the DCI, and it is therefore an offer to countries across the globe to use modern digital technology without costs for the management of their social protection systems. And lastly, this initiative will also contribute to and serve the global accelerator on jobs and social protection for just transitions. The ILO is leading the global coordination on the global accelerator, and we are very pleased that they're also a key implementing partner of our new program. With the support of the ILO, we will ensure that the DCI will make digital expertise available in the global accelerator countries of implementation, the so-called Pathfinder countries. We are also particularly pleased to be working with the World Bank for this program. The World Bank will bring its technical expertise, its strong in-country presence and links with governments to make sure that the standards and principles developed by our program find real applications in partner countries. By focusing on the digital transformation, this initiative also aligns with the European Union's Global Gateway Investment Agenda, which stands for sustainable and trusted connections that work for people and the planet. The Global Gateway supports partner countries in their economic, green, and digital transitions by providing a qualitative offer. It is anchored in international values, norms, and democratic principles, and it is a vehicle for contributing to the 2030 Agenda and the Sustainable Development Goals. Digital transformations, like all sectors, holds the promise to strengthen at the same time social protection, but also to make it more adaptable, more transparent, and more inclusive. Countries worldwide are strengthening the digital backbones of their systems to take advantage of this promise. And our new program exactly taps into this interface between digital transformation and the Human Development Agenda to make transitions people-focused. And the European Union will continue to foster a human-centered approach to digitalization. Human-centered digitalization in social protection can re-engineer and improve some of the ways in which social protection is delivered, all while meeting basic needs and respecting human rights. Let me give you some examples. Digitalization has the potential to accelerate coverage of social protection. During the COVID-19 pandemic, digital technology was used as an effective tool to transfer social assistance to new beneficiaries. Within 6 months of the start of lockdowns, over 200 countries rolled out more than 1,000 social protection programs. Over 60% were direct cash transfers. Of these direct cash transfers made, more than 80% included digital delivery. Programs were designed to locate and reach those most affected by the pandemic, for example, the urban poor in Togo, while using mobile wallets for payments. Better data use can also improve the efficiency and the transparency of social protection systems. In enrollment and screening, for example, a digital process can ensure that data is collected only once. This reduces fragmentation across government ministries and avoids inefficiencies and inequities. For example, in Bangladesh, the European Union is supporting the government to consolidate its digital public infrastructure to better serve the population. Through our budget support, we are helping the government establish a fully operational single registry as a comprehensive digital end-to-end solution covering the entire process from beneficiary selection to delivery. Overall, and most importantly, when using digital technology, We always need to be mindful of exclusion, not to leave anybody behind. This new intervention will ensure that digital social protection systems do not discriminate against those who are unable to use basic digital tools or persons with disabilities, for example. It will also protect beneficiaries' right to privacy and data protection. As the digital transformation is still a relatively new area of work, by closely working with implementing partners in this program, we will be able to leverage the respective experience in digitalizing social protection management information systems. We will not only employ our experience in data protection, but we will also be able to collectively explore and share lessons in interoperability and the portability of benefits across countries. Allow me to conclude by situating our program within the SDGs under review in the high-level political forum. Social protection is the sharpest tool for the eradication of poverty and therefore directly contributes to achieving SDG 1. We saw this link very clearly during COVID-19, but we are now faced with a multitude of other crises, including new health and climatic threats, shifting demographics, and increasing socioeconomic inequalities. More than ever, we need to increase social protection coverage and improve the efficiency with which it is delivered to populations. And we cannot address this challenge alone. Partnerships are needed. SDG 17, which is also being reviewed at this high-level political forum, reminds us of this commitment. As I already emphasized, this new initiative allows the European Commission to team up with Germany, France, and Spain in a Team Europe approach. We are also strengthening our ties with the ILO and with the World Bank. And partnering with these global leaders on digital social protection, we will secure a rights-based approach to our intervention and widen our global outreach so that almost any government in need for a digital solution for social protection can benefit from our program. I thank you for your attention and for making this work possible. Thank you.
Thank you so much, Martin, for this high-level overview of the program, objectives, the partnership involved, and for encouraging this initiative going forward. Thank you so much for this. I want to recognize the participants who have been posting on who they are, and thank you for doing that. It gives us it helps everybody get a sense of who's around. Thank you. I now turn to Anita Mittal and to Saurav Bhattarai. Anita is leading the Digital Convergence Initiative for GIZ. She is a computer engineer. She has extensive global experience working on social protection, identification systems for the World Bank. She worked on the e-governance applications for Digital India. And prior to that, she was a software engineer in the private sector. Saurav Bhattarai, he's the team lead for the openIMIS coordination desk at GIZ. He's been working on issues of digital transformation in health and social protection since 2013, and is focusing on the sustainable development of digital public goods in low and middle income countries. Welcome both. Anita, the floor is yours.
Thanks, Louis. Yeah. So now I'll provide you a quick introduction of DCI, what it has done so far. Yeah. So the information systems are indispensable for delivery of social protection. And I don't think anybody would challenge this statement after what we've heard from Shahra and Martin. That COVID has starkly shown us that countries which had information did well, and this is needed to achieve the goal of USP2030.
Apologies, Anita, if you can click on the desktop presentation, on the presentation mode, I think it will be clearer for everybody. I know you have some small details in the slides, so please, if you can press on the presentation mode. It's either down there. Yes, exactly. Slideshow. You're using two screens. You should share the one. The presentation appears. Or else we can ask our colleagues from socialprotection.org.
Yeah, I think
Perhaps,
you can normally
yes.
put, I don't know, I tested it, yeah.
Okay, Fernanda, would you? Thank you.
The next screen, please. Next. Next. However, these social protection delivery systems are very complex with multiple interconnected components, and some of these systems interact with digital public infrastructure like the identification system, payment system, the civil registration system, the social registry, integrated beneficiary registry, as well as many other sector-specific systems for delivering social protection. These systems, when they're integrated and interoperable, they enable efficient, responsive service delivery, which is citizen-centric, helps in targeting, achieving efficiencies of program delivery. Moving on, we see that this potential is largely unrealized. Countries struggle to build these systems. They keep reinventing the wheel over and over. And when these systems are developed, we often see that the systems are not talking to each other. Making them talk again is another project. So to address these problems, as you will see in the next slide, the Digital Convergence Initiative was kicked off in the year 2021 as a joint effort by members, non-members of USP2030, governments, development partners, and private sector towards achieving harmonized and interoperable digital ecosystem for improving the efficiency of social protection program delivery, thus supporting the digital transformation of social protection systems to enhance social protection outcomes. And to achieve this interoperability, what you need is standards. So one of the key work streams of Digital Convergence Initiative is development and building consensus on these standards, which are lacking for the social protection sector, while we do have well-defined standards for the health domain. So we believe that these standards will help in an ecosystem of innovation, reduce the time and cost required for development of systems, because people will be able to mix and match different components from different providers, picking the best that works in their context, and also ensuring that the systems are future-proof by design. So let us see what DCI has done so far in achieving these objectives. The approach was to first learn from countries who have done well, learn from their challenges and the lessons learned. How did they achieve it? And what are the challenges some of the countries who are trying to achieve integrated and interoperable systems are facing? Towards this, we started this Talking Interoperability, where we have 15 countries raise their experiences of delivering social protection and developing integrated social protection systems in their country context. We have also published some DCI knowledge products, like how do we apply principles of digital development to the social protection sector, looking at interoperability of social protection systems with farmer registries, as well as the learning briefs for some of these talking interoperability sessions. From talking interoperability, we move to interoperability in action. It's no more talking now. We see live demonstrations of interoperability use case between different components that are involved in social protection program delivery. So we see how a social protection system interacts with a civil registration system, payment system, ID system, and others through live use cases, listening from countries how they present it, And for doing these live demonstrations, we have heavily leveraged on digital public goods or open source software, which we set up in our demonstration toolbox, sandbox, to demonstrate and build confidence on the power of interoperability. So moving on, we will just show you a quick glimpse of in the first phase of DCI, we are looking at these 7 interfaces where a social protection information system will talk to a civil registration system or an integrated beneficiary or social registry, payment ID and farmer registry and disability registry respectively. Each of these interactions are unique in their own ways on how the different components interact with each other. So we will look at the process standards, the data standards, or what are the data elements being exchanged, and what are the requests and responses that the two systems needs to exchange to share data with each other, how we can standardize them for the social protection sector. And to do this, we took the concept of developing standards committees as being done in various other standards organizations. So for the DCI also, as you will see next, we have constituted standards committees. In the next slide, you will see how these standards committees are organized to ensure that there's representation from the different kinds of stakeholders. So we have 2 co-chairs, one from an international organization and second from a country, to ensure that we are very much grounded on what we are developing. We are not developing standards in the air. We have representatives from subject matter experts, academia, international organizations, country representatives from the different regions of the world, civil society, solution providers, both from the private sector as well as the open source and digital public goods providers, as well as active interaction and collaboration with the standards drafting group. The standards drafting group could be set up under DCI, or it could be another initiative or program trying to submit the standards for consensus building and global adoption in the social protection sector. So in the next slide, you will see that we have defined a very well laid out process on how these different stakeholders will interact and build consensus, ensuring feedback from the public and the various other stakeholders during its consensus building process, and then endorsement by USP2030. You will see next that we have created the first committee, which was for the interoperability of a civil registration system with social protection system. And here we are proud to say that we had participation from 17 different organizations, and all these 18 members contributed their expertise pro bono to help for this greater social cause and digital public good of open standards, which will allow interoperability of social protection systems. So here, as you will see, you have got the DPGs, you've got similar initiatives, international organizations, as well as country representatives who helped us build consensus. And the result you will see in the next slide, that we have been able to submit these standards and released it by USP2030 as the first set of DCI standards for interoperability. And we did not stop just with defining these on paper as specifications, but they were adopted by 2 digital public goods, openSPPP for social protection program delivery and openCRVS for a CRVS system, to show that how 2 different systems can exchange data using these standards. Moving on, we have seen that we have set up another standards committee combining 2 domains because of close overlap, the social registry and social protection delivery system, as well as an integrated beneficiary registry and social protection program management information system. And here we have got again representatives from various organizations participating actively to help us build consensus on these standards. Moving on, we will see that with the support provided from EU, we have an exponential increase in the funders, the implementing partners, implementing the DCI program, the community which is supporting us, and the mandate of DCI to deliver digital transformation and interoperability in social protection sector. So as you will see, we are organizing our program in the next slide that there are 3 key pillars. The first pillar we are calling as knowledge sharing, where we would have digital knowledge base, where knowledge products written as well as events will be held, where people can share the best practices for achieving digital transformation in social protection sector. And this knowledge base will be a digital public good available to anyone publicly. The second stream would be development of global standards and creation of a repository where the standards will be housed, made available to anyone with a process for providing feedback and continuous updation of these standards, as well as adoption of these standards supported by DCI for implementation of their solutions so that we have digital public goods interoperable by default, by design, from birth, for adoption by countries, so that interoperability comes baked in these solutions. So having developed these standards, the main objective is for using these in countries. So we are going to support 10 countries in 3 years. So 10 in 3 country implementation support by the various implementing partners, which will help do an assessment in the countries of digital social protection systems, implementation of standards or digital social protection measures for achieving digital transformation while enhancing the capacity of the countries in implementing these digital transformation measures. With this, I hand over to my colleague, Saurav, to explain about openIMIS.
Sure. Thanks, Anita. So I'll be talking about the investment from the European Commission in openIMIS now. So next slide, please. The openIMIS is the sector's leading digital public good software to help governments transform digitally, leverage digital public infrastructure, and achieve the much needed efficiency in managing social protection programs. As a free open source software and using sectoral standards such as the DCI in social protection and openHIE and FHIR in health, openIMIS currently is implemented in 12 countries, managing over 15 different schemes and overall benefiting more than 23 million people worldwide. A point to note here, as you see the map, is that these implementations that you see on the screen are funded through various organizations and modalities. So being a true digital public good and being open source, openIMIS allows different implementations to build on top of each other's achievements and really grow the software along with their implementation. These implementations also span the wide spectrum of social protection programs, from social security to social assistance, through our various solutions. And this is all made possible by the diverse community of practice of the openIMIS community, as well as with the strategic partnerships. The community of practice is currently represented from over 20 countries and consists of users, sectoral experts, as well as software developers, all working towards bettering of the openIMIS product. In terms of strategic partnerships, the openIMIS team has been engaging with the World Bank since 2023 to merge the core MIS tool from the bank with openIMIS, a merger that has now allowed in the creation of the core MIS solution powered by openIMIS for managing social cash transfers and increasing the abilities of openIMIS itself. Partners such as the ILO have also been instrumental in increasing the reach and implementation of openIMIS. Over 4 implementations globally have been supported by the ILO, and it's growing, particularly in its use in the formal sector, the social security settings. So with continued collaboration with the ILO and ISA, We hope to develop new solutions powered by openIMIS that will be applicable to many more implementation scenarios. With these partnerships and with resources from the BMZ, the Swiss Development Cooperation, and the European Commission available to the openIMIS initiative, and the support of the wide variety of organizations supporting individual implementations in various countries, we aim to grow and provide more, better, and sustainable solutions for managing social protection programs globally. If you'd like to learn more about the openIMIS tool and the initiative, please feel free to reach out at the contact information on this slide or through subsequent exchanges in social protection on socialprotection.org or through the DCI. With that, I thank you very much and hand over back to Luis.
Thank you so much, Saurav. We have now about 25 minutes of panel discussion, and it's my pleasure to introduce you to three speakers. First, Naveed Akbar is currently serving as the Director General of the National Socioeconomic Registry Conditional Cash Transfer for the Benazir Income Support Program of the Government of Pakistan. He has over 13 years of experience in the Ministry of Social Development and Family in different positions, and has worked for the Ministry of Finance before. So he has extensive experience in designing, implementing, and monitoring social protection programs with a focus on social registries and conditional cash transfer initiatives. Verónica Achá Alvarez is the head of Social Information Division at the Ministry of Social Development and Family in Chile. She's a civil engineer in computer science and a Master of Science in Public Policy and Management, with 10 years working in the ministry and more than 20 years of work experience in roles that intertwine information technologies and public policy. She was also co-chairing the first DCI Standard Committee for Interoperability of CRVS and SPMIS, and she will share a little bit of that experience. Finally, Jamele Rigolini is the Senior Advisor for Social Protection and Jobs in the World Bank Social Protection and Jobs Global Unit. His areas of expertise include social protection, labor markets, jobs, skills, human capital, poverty, and climate change. Prior to joining the World Bank, she was an assistant professor in economics at the University of Warwick, where he taught classes on development economics and economic growth. And he holds a diploma in physics and a PhD in economics. His policy work, in addition to his policy work, remains actively researching and publishing. So without further ado, let me turn to Verónica, if that's okay. So Verónica, welcome.
Thank you.
My first question to you is that we know that Chile has made very significant advancements in digital transformation of its social protection systems and has been using interoperability more and more. So what we would like to know is what were the original motivation, what was the original motivation and the problems that you were trying to solve when deciding to digitalize and make the systems, the different components, interoperable, and what are the building blocks of this digitalized SP system in Chile? Big question, but
yes, it is.
You can synthesize. Thanks.
Okay. Thank you very much for the invitation. Well, in Chile, we seek to have a registry that could bring together all the people in the country, even those that only potentially could be beneficiaries of some social benefit. For this reason, in Chile, we moved to the Social Registry of Households on 2016. This registry contains not only information on vulnerable people, but also on middle class and somewhat more affluent people. To build this registry, one of the main tasks was searching for administrative records that will allow us to see the real income of the families with better quality and more updated data. Previous to that point, we used to work with self-reported data regarding income. Also, we left behind the proxy means test approach. Just to use these administrative records to identify the level of vulnerability of the people. And we work then with data from different organizations. We see income from work, from pensions, from capital, and also the standard of living of the families. Furthermore, bringing this data from different institutions instead of asking people to self-report this data, transfer the burden of collecting this information to the state instead of giving that work to the people. Anyway, people can or may update, rectify, or complement this data if they disagrees with the one we are observing, which is very important to them and to us also. I think that key to reach this point has been the development of interoperability in the country, both to have access to this social registry and to have better information for targeting decisions. And on the other side, this interoperability allows us to share information that our ministry has with other institutions that can use that information for their own purposes in terms of their role on the social protection system. And below this, it was, of course, that the country was ready in terms of technology and in terms of connectivity that allows us to perform and to implement this interoperability between the countries. Previous to 2016 or maybe 2010, it was impossible, unthinkable in having a registry like this one. I guess I answered your question.
Thank you. So primarily, really, the unburdening the load to recipients of having them providing information and so on. So really, the concern with the end beneficiary to make it less costly for them to benefit from several benefits. So thank you very much. Very clear. Let me turn to Naveed. Akbar, welcome. And we'd like to ask you, you are responsible under the National Socioeconomic Registry, and we know the NSER has been established as a central pillar of digital transformation in Pakistan's social protection program delivery. Could you tell us a little bit about the role of this particular registry and how does it relate to other key elements in Pakistan's digital social protection delivery?
Yeah, so hi everyone, thank you, Luis. First of all, thank you for having me here to share our country's experience. So as you are aware that National Socioeconomic Registry, NSER, serves as a primary data registry for the identification and targeting of the beneficiaries, not only for the Benazir Income Support Program, which is a premier social safety net of Pakistan, but also serving as a targeting platform for other social protection initiatives that we have in Pakistan at federal and provincial level. So so basically we are using this registry as a single targeting platform for identification of the people, for the different interventions, for cash-based programs, and also in-kind cash transfer components. So, you know, we traveled a long journey to have a digital transformation. And I think one of our colleagues rightly mentioned that importance of having a digital transformation during the COVID was the major turning point, and also for Pakistan. To just let you know that we also started building our registry with a paper-based approach back in 2011 when we collected the information on paper. Roughly 27 million households data was collected at that time. But the major criticism that we were getting at that time was regarding the coverage and ensuring that we are including all the households as part of the database. And I think the basic principle of equity is or the starting point for identification of the vulnerable population is to first have all of them as part of your database. And I think we realize that with the paper-based approach, it is very difficult to ensure the 100% coverage or the coverage of the areas which are hard to reach. So with that lesson learned, we had the digital transformation, and back in 2019, post-COVID, we introduced digital means for the data collection. We incorporated the data collection through tablets, ensuring that we have the household listing done through GPS coordinates, in order to make sure that we are reaching to all the areas and ensuring the coverage of all the households. So that gave us an holistic picture for ensuring that we are making every household as part of the database. Then the second thing that we did through this digital transformation is that we ensure the interoperability with other databases for the real-time validation and verification, like linking it with the civil registry to ensure that the information that we are collecting is accurate and we are validating it through that, linking it with the different administrative databases, linking it with different mobile data networks and other things, so that we can have accurate information available of the population before we reach to the point where we will actually start enrolling the population for the benefits. And this digital transformation has actually helped us not only for our regular cash transfer programs, but really helped us and paid off during the crisis situation. Because with the help of GPS coordinates, let me share with you the example of the flood that we faced back in 2022. We were able to identify the affected population and able to roll out our program within 10 days of the flood. And we actually identified the affected population living below the poverty line, and guided the government to actually immediately start the cash transfer program. And similarly, this digital transformation and the database that we are establishing, we are quickly having the horizontal expansions of the program, not only the social protection entity that we are managing through it, but also like subsidies that the government of Pakistan is providing. Now it's been linked with the National Socioeconomic Registry, whether it's in kind or in cash subsidies. So this digital transformation is not only helping us in identification of the people for the regular cash transfers, but also helping the government to move from untargeted to targeted subsidies. And especially after having this digital transformation, we can say that this is now, or Pakistan is now become an adaptive social protection entity to help the people, especially in need. So these are the few elements that I wanted to share with the audience here.
Thank you. Thank you so much. Very, very clear. So really a focus on identification, inclusion, not missing potential eligible beneficiaries, the responsiveness and the dynamic shock responsiveness of the system. Really, really interesting. Let me turn to Jamele from the World Bank. You are a DCI implementing partner, and it would be interesting to know from you what you see as what is digital transformation in social protection for the World Bank, and as a DCI partner, how do you operationalize digital social protection in your projects to improve social protection delivery?
Thank you. It's a pleasure to be here. Just to say, we are firmly believers in the power of technology. We started with cash transfer more than 20 years ago, and we started with the first paper-based registries. They couldn't be updated for 5 years. So for us, digitalization in our support to countries was really a need. It's not that it was a vision, it was an immediate need because we wanted to progress. And that grew organically. We started working very well with countries including Chile, Brazil, in Latin America, and then we extended now in Pakistan too. And now we are actually in more than 70 countries, and we have a portfolio supporting directly and indirectly around 280 million people, and 60% of our portfolio has some digital delivery support component. So for us, it's becoming part of our DNA. And the digital convergence initiative is very important because we are facing these interoperability challenges on a daily basis. Let me stress, it's not only the interoperability challenge we were facing, but it's also the open source challenge. Our first registries, I still remember traveling in a couple of countries, we didn't know how to implement them well. So we had to, with the country, we had to contract out the implementation of the beneficiary database or the registry, and we were stuck with consulting firms who own the code, own the source, own the program, and it was very expensive and very inflexible to actually change or make any change. So that's why we really welcome the move to open source for that. Now, we are also, over the years, have learned a little bit to acknowledge the risk of technology. One thing we shouldn't do is to just, promote technology for the sake of it. Technology has immense power, and as in the Pakistan example has demonstrated, it's not only normal time, it also allows to respond more to crises, including economic and climate change shocks. But there are also inherent risks we need to consider. We cannot move out from a people-centric approach. It's an example I personally helped. I was witnessed. I used to live in a EU country during COVID, and I had to help heavily someone apply to some social protection benefits through the system because the system was too complex. It wasn't necessarily tailored to the profile of people who need it. So that's one risk. And the other risk I've witnessed is we cannot afford to be in a situation where the answer is, oh, the system doesn't allow it. It's the system should be at the service of people, is not people should be at the service of people. So I think there are caveats. We really need to work to make it flexible centric, but this is for us, it has been a game changer and a true revolution in delivery. And that's also how we can quite confidently say we can expand further support, keeping some good governance in place. So thank you very much.
Thank you. Thank you so much for really emphasizing some key milestones and some key, let's say, principles of implementing technology, the open source and the risks, and making sure that it is inclusive. I think we have time for a second round of questions, and this time let me start with Jamele, because I know you have to leave soon, but so let me start with you. So having that in mind, having those lessons that yourself you've had over the years, can you give us examples of how this new dimension of digital transformation, which is interoperability, what is the potential to improve efficiency and impacting people? How do you see interoperability really making a difference in today's digital transformation projects?
So thank you. Oh, it's making a huge difference. Let's start with normal times. The dynamic registry, it's a complex name, but basically it means that people in offices like municipality, if I'm correct, in Chile or social protection offices can directly update the information when needed. They can directly access up-to-date information. That really speeds up tremendously the selection process. One can almost instantly understand if the person is eligible or not. That is one. The other one is there is a much clearer sense of which are the benefits available. Actually, many social workers in many countries are not aware about all the benefits a person is available. Thanks to digitalization, to a registry not only of people but also of programs like the DIA platform in Ukraine, or again some complement of the Registro de Hogar in Chile, you can really, the social worker can really have an idea of all what is available to the person. Now that is interesting because we shouldn't forget again the broader system. There has been example of the program being available, but the money not being available. So people being rejected for programs that are eligible because the financing wasn't there. So there are actually complex systems, and we shouldn't always look only at the digital solution, because that would be a big mistake. There is also the system solution, and that's where it is important to really have a good understanding of social protection. Now, when we move to resilience, to shocks, COVID, but only climate shocks, it's incredible what these systems can do. We are linking systems with DRM, disaster risk management, early warning systems. We are not there yet in all the countries, but it's incredible. In Bangladesh, they can predict floods and actually pay the cash even before the floods happen. In Senegal, they are also having quite good DRM systems. And in Pakistan, it gave an example of what the power of digital technology during COVID. I think it's great. It allows us to react faster and more accurately. Before, we could be fast, but we couldn't necessarily select the people. There will always be mistakes, and I would like to repeat it. There will always be mistakes. So we really need to have a statistical analysis of accuracy, not a person by person. But we can be much more accurate, which means we can really direct now the resources to the people who need it most. Thank you. And as I said, I need to leave, but it was a pleasure being here.
Thank you, Jamele. We do have a timekeeping problem. I'm trying to keep within the next 5 minutes, but perhaps just a quick question and answer to Naveed first. Looking at the case of Pakistan, could you tell us precisely how these two components, the digital identity and digital payment systems, how do these systems contribute? How are they being leveraged for really truly interoperable social protection? And how do they make an impact in Pakistan? You're muted.
Yeah. So yes, Luis, we have the digital identity systems through our civil registry. So we have the biometric of each and every citizen of the country. Like I'm talking about the National Database Association Authority, who's responsible for managing the civil registry. And I said before, our dynamic registry is also linked with the civil registry in terms of verifying the identity of the individuals. And since we incorporated this our payment systems using the biometric-based payment systems. So what we are doing is that we are cross-verifying the identity of the people using biometric system through our civil registry. So it helps us in ensuring that we are reaching out to the right person in terms of payment delivery. So like quickly, if I can share example with you, that between 2012 to 2018, we used to disburse the cash transfer using the ATM cards or the debit cards. But that is a good thing for the regular cash transfers. Like, you identify X number of families, you made their ATM cards and you started disbursing the cash transfers. But the problem in that debit card system is that one, you need to ensure a proof of life for after every certain period. And then in terms of the horizontal expansion, it was a challenging to have the horizontal expansion when you are doing disbursement through ATM cards, because we faced flood back in 2010. And when we identify the population who was affected by the flood, we took a lot of time to actually issue the debit card, and it was a one-off cash transfer. So with this digital identity, like this biometric-based identity, we are quickly disbursing the cash transfer, without going into a process of opening a bank account or issuing the debit card. And we had two examples. One is during the COVID, when we did the horizontal expansion. So from 5 million, we actually provided support to almost 15 million during the COVID, a one-off cash assistance. And then flood, we again provided support to 2.8 million families affected by the flood in no time. So that is basically the biggest advantage that we had. Saving times is the biggest advantage that we had using the biometric-based payment systems.
Thank you. I think we'll keep it for now on that. And thank you so much. You really provide a very concrete use case of interoperability with such a big impact. Verónica, now to you. You were one of the two co-chairs of the first DCI Standards Committee. And obviously, you know about how the workings of the Standard Committee of the DCI operate. Can you tell us how can countries use these standards to advance social protection interoperability in practice? How do you see the value and the importance and the use of these standards in the countries?
Thanks, Luis. Well, I think that the work on the Standards Committee was especially enriching to all of us because it brought together professionals and people from very different backgrounds to address a common challenge. And that was very important, no matter how different our social protection systems were. In essence, we were able to identify concepts and elements that were applicable to our countries, that even if we were very different in other modes, and propose standardized solutions. And I think that was very enriching. The common standards address the main elements necessary to implement robust, interoperable, and more effective social protection systems. So I would say to countries that are just beginning in this path to start digitization by reviewing the proposed standards. No start on blank page. You see the proposed standards and the tools that implemented them, so as to start on a solid base. After that, maybe you will need adaptations, of course, but you will learn that only once you cross the first stages.
Thank you. So really use them as benchmarks
yes.
and to start looking at what is the best practice internationally. Thank you so much for that. I think we've concluded successfully the panel. Thank you to all the participants, the speakers. Let me now give the floor to Kathrin Oellers for the closing statements. Kathrin Oellers is the head of division Social Protection and Sexual and Reproductive Health and Rights at the German Federal Ministry for Economic Cooperation and Development, BMZ. Prior to assuming this position, she's been working for 20 years in various roles within BMZ, including as head of division on policy issues, cooperation with Asia, Southeast Asia, and then at Development Council at the German Embassy in Hanoi, Vietnam. Over to you, Kathrin, for the closing remarks. Thank you.
Yeah, thanks so much, Luis, and everyone. And thanks a lot for this really fascinating and very informative discussion. And I would also like to thank our panelists for sharing these interesting experiences. And I see in the chat and in the Q&A that these have really generated a lot of interest. And we see there are a lot of experience to be shared. And I really highly appreciate that this is really a practical issue where we see that people are concerned with the implementation in the countries and we can share best practices. So I'm really very happy and I hope we can follow up on this event. I think the discussion also showed that digital technology holds really great potential for achieving universal social protection, as it can facilitate access, increase transparency, tailor service packages, and I think, which was highlighted a lot, ease the burden on the side of the administration as well as the recipient, the citizen. But I think it showed, as Jamele was, for example, mentioning, that it's really not just a mouse click away, but it really needs a lot of work to implement these digital standards. So I hope all of us are inspired today from this discussion to follow on this important work. Let me just quickly use this opportunity to mention that from the part of the German development cooperation, we are really very much pioneering in digital social protection systems and have financed the Digital Convergence Initiative right from the start in 2021 under the global partnership of USP2030. And next to this developing of standards, we also put a focus on ensuring that those standards can get applied. which is why we also support from the beginning the development and also the application of the digital open source software openIMIS that Saurav was presenting to us before. And of course, as this, we are really very happy today to see this new partnership emerging as a Team Europe initiative with EU INPA, with Spain and France, and of course also ILO and World Bank as partners. And we really think here we need a lot of collaboration and partnerships and talking between each other to make these digital convergence really happening on the ground. We are also happy to have a strong link to the Global Accelerator on Jobs and Social Protection and the Multilateral Financing Initiative with the World Bank and the ILO, which we support as well. And it's great to hear that through the Digital Convergence Initiative, Pathfinder countries of the Global Accelerator will be also supported in applying digital solutions for social protection systems. So I think the discussion really showed that value is added at the local level, and it was really great to hear from the experiences in Chile and Pakistan about the excellent progress and impact that these digital solutions made. And this is really, I think, something others can learn from. And I hope with this new partnership, we will have the possibility to spread those best practices. And I also must say, also from the German perspective, I think there's a lot we can learn. And I was really listening very carefully to your reports on digital identity and what you have implemented also to reach people quickly and expand the systems. It was also great to hear that digital social protection really helps in times of crisis. And we all know we have a lot of, unfortunately, there are multiple crises and we really need to make our social protection systems adaptive. So it was great to hear from the examples from Pakistan, how this worked in the case of COVID and flooding. And I think we have a great potential here in many countries where we still can work to make this happening even better and establishing also the link to the disaster risk management. So, yeah, I think there's not much to add. I'm really happy to see here a lot of practitioners, development partners, governments, civil society representatives, and everyone very engaged in this discussion. So I really hope that we can make a change, and I'm looking forward to the cooperation within this partnership. And I think, as Shahra also said in the beginning, let's not lose sight of our ultimate goal, which is close the social protection gap for all and really make access possible to everyone. And I hope we can make a contribution by this partnership. Thanks a lot for the very inspiring discussion. And thanks a lot to you, Luis.
Thank you, Kathrin. With those inspiring words, we end this side event with our thanks to all the participants and the speakers. We hope you stay connected. Please go to the DCI websites on behalf of all DCI partners. We wish you a very good day. Thank you.